Hello everyone, welcome back to Baby Bump Life. I want to talk to you all today about infant CPR, and I want to give you 5 tips today about infant CPR. I have to give a little disclaimer, this is not a certified CPR course. Which leads me to tip number 1. I recommend that all first-time parents, all parents, get certified in infant CPR and choking. It is so important to do. Yes, we have 911. Thank God for our emergency responders. What would we do without them? But it takes minutes before they can get to your house. And it takes seconds for you to do something to help save your baby's life. So it's so important to take a course and to become certified. There are different levels of infant CPR. You don't always have to take the same level of CPR that the nurses and doctors are required to take in the hospital. You can take like a family and friends CPR course. The Red Cross offers courses. So there's different levels that you can take where they can tell you just the basics of what to do. Today I'm going to give you a few tips on some things, but again, I want you all to get certified. I want you to understand it is so important for you to do. Number 2. I want you to all be prepared as well and to stay up to date with the information. Maybe you've taken the CPR course 5 years ago and you feel like you don't need it anymore. Well, guess what? Research is always happening and things are always changing. I've been a nurse for 8.5 years now, and there are differences in every CPR course that I take. They do recommend, at least for nurses in the hospital, we have to keep up to date on that every 2 years. So that is a recommendation for parents as well. Keep up to date on that because things are always changing and we're learning more and more about our bodies, and something that is new could help to save your baby. So always make sure you're not just certified, but you're staying up to date on that as well. So when you take the course, they're going to have practice dummies there. Little baby dolls that you'll practice on, and they will go around and make sure that you're doing it the correct way. That's why I can't certify you through this YouTube video, because I can't ensure that you're going to do it the correct way. So please, again, make sure you take that course. So one of the first things you want to make sure you're doing with CPR is making sure that you're in a safe environment. So if you're in a parking lot, make sure you're not just standing in the way where you could get injured as well. Making sure you're always in a safe environment. One of the basics to go over. So you will learn in the class that when performing CPR, you always want baby to be on a firm, flat surface. If you're ever finding baby with no pulse, not breathing, no movements, not stimulating, and baby is on the crib, you want to make sure you're removing them from the mattress, putting them on a firm surface, the floor, a table, the changing table, whatever it is, a firm surface, so that when you're doing your compressions, they are going to be effective. If you're doing compressions on a soft surface like a mattress, they're not going to be as effective, right? So making sure you always move baby to a firm, flat surface. Okay, so tip number 4. The next thing that they're going to show you guys is they want to make sure the placement is correct. You want to put your fingers just below the nipple line. The dummies that you'll have in the class are atomically correct for the most part, so you will be able to see that, and you'll be able to make sure that your hand placement is correct. And when your instructor goes around, they will make sure that you're doing the correct depth, which they will go over in the class. Okay, so we just talked about what to do with the compressions, where you want to do it on a firm, flat surface. They'll talk about how many that you will do during the course, but just a little bit of information, it's going to be 30. You're going to do 30 compressions, okay? After the 30 compressions, you're going to do 2 breaths. And tip number 5 is for the 2 breaths. When you're breathing into baby, you want to make sure you're just breathing about the amount of air that you have in your mouth it's going to go over the baby's mouth and the baby's nose because our mouths are bigger, right? We want to make sure that we're covering that. No need to block their little noses. Our mouths should be able to fit over their mouth and nose. So when you're giving them a breath, just the amount, like I said, that you have in your mouth at that time. When you give that breath, you should be looking at that time for the chest to rise. Once you see the chest rise, that's it. That was your breath. That's one. Then you give the second breath. Just important to look for that chest rise and to make sure that your mouth is over the baby's mouth and the baby's nose. As always, guys, make sure you are calling 911. When you take the course, they're going to explain to you the importance of doing that and when to do that. What I mean by that is if you're by yourself, they will have you do 5 sets of the CPR that we just kind of went over before you call 911. If someone else is with you, you're going to point to that person. You call 911. Making eye contact, making sure that they are aware that they are going to go and call 911 for you and get them on the phone, put them on speakerphone. They're going to help you out. Maybe you aren't doing the compressions fast enough. Maybe you forgot a step because so much is going on. They'll be able to help you. So making sure that you do call 911 and take the course, guys. You will not be disappointed. It's something that you want to make sure you do because, like I said, seconds, minutes, they matter, especially when it comes to these babies. We want to make sure we're doing all we can. Infant CPR is for 1 year or less. So once your child is over 1 year, you want to make sure you're certified in child CPR. There are courses you can take that are just infant CPR, and then there is a family and friends course that is the whole adult, child, infant CPR, which is good to stay up to date on all of those things as well. Just some information for you guys. I hope that helps you. Again, please take the course. Please don't take this short little video that I just gave you a couple tips on and think that you're certified. So I hope that helps you guys. Thank you so much for watching and stay safe, you guys. Take care.